So I will give us just a few minutes to do that. Then we will jump into the program. Our guest, I can see that she's already here with us, and she's very much ready, as always, to give you guys the best. So I have someone that will be discussing this very important topic with me, and I'll be introducing her shortly after giving the intro what we are here to do today. So kindly let your friends know that we are starting. I don't want us to waste her time. She's a very busy person. I know how hard it is for us to get her. So we wouldn't waste that time. We'll give her the opportunity to start talking to you guys. But I want many people to be here. We have seminars and programs with people, and we have lots of participants. We've had close to 500 participants in the past. That is what I want to see here. So let your friends know that we are about to start. So once it's 1 p.m., we are just going to start. We will go and go into the program and start immediately. And yes, Laurie, you can share your screen, but I just want to give a little intro to the program before we start. All right. So I'm going to, thank you. All right, I'm going to make you an admin in a short while so you can be able to share your screen. Okay, guys, today is Tuesday, the 19th of April 2022, and we are here today live to discuss Nurse Empowerment Project, a project that is going to empower you. We are all nurses. Everybody that is here are nurses, and we are here to discuss and talk to ourselves in the language that we are going to understand. So we don't have anybody here that we're going to be breaking down the terms so you can really understand, because there's lots of things to be discussed. There's lots of things. I've gone into this discussion with our guests, and there is so many things. I don't even know if we'll be able to finish everything. But as you all know, right now, currently, we've had lots of litigations, lots of problems affecting the nurses worldwide. In 2020, it was the year of the nurse, and everybody celebrated, everybody was happy. And just at the verge of that, the COVID came, and nurses were also appreciated again, because we were at the forefront. We are regarded as health care heroes. We are taking the bullets at the forefront of the healthcare system. Everybody appreciated us, and that was very nice. That was exciting. And today, the reverse is becoming the case, because a lot of patients, a lot of hospitals are now looking into what is the nurse doing, how can we get to pin down this nurse, how can we get to litigate this nurse. Anybody that loses a patient in the hospital tends to go back on the record on how the patient was cared for, and how can we get the hospital to give us some money and the rest of them. So, but there are things that you can do on your own to be able to protect yourself and protect your license. Remember, this NCLEX that you wrote to suffer. So I'm an NCLEX coach, so I know what people go through to be able to write the NCLEX exam. So after doing all that, imagine coming to the United States and being told that you cannot practice with your license. I know all of you are saying, God forbid, that's not my case. Well, yes, God forbid, but we have to do something for God to forbid it. And I think it's an avenue that God provided for us to be here, so you can learn how God can forbid an evil ordeal from coming your way. So today I'm going to be welcoming someone that is well known to me, somebody I've really interacted with a couple of times, but those times were very impactful. She has taught me a lot, both as a healthcare practitioner and also an entrepreneur. She has really given me an insight to what I need to do as a person and as a professional. So today we have Laurie. Laurie is, I'm gonna give you guys an intro about who Laurie is. But before, remember, when you come in, kindly remember to mute yourself, because we have other people in the program and we are hearing background noise from your side. So I'm already muting everybody. So, but also try to do that on your side. Okay, so today I'm just going to go quickly and introduce our speaker. Then later on, we're going to discuss something after she's done. I'm going to just go straight to our speaker. So meet our presenter. Our presenter, her name is Laurie A. Brown. So Laurie A. Brown is one of the nurses that I respect so much. She empowered nurses. Empowered Nurses was founded by Laurie A. Brown, and she's a registered nurse. She has masters in nursing before progressing to do her law. And with over 30 combined years as a registered nurse and as an attorney, Mrs. Brown combines her specialty with practice of medical legal consulting and representing nurses before the licensing board. So Brown Law Office was built by nurses attorney for nurses, and they work with nurse attorney and attorneys with expertise before the licensing board nationwide. So when they say nationwide, it cuts across the entire United States. So whatever you are, if you have any problem with your license, if you get them to get a hold of them, they can help you out, which means they are the best people to advise us on how to protect that license. We teach you NCLEX, but these people will teach you how to protect your license that you get from passing NCLEX. So that is where we are today. And it's going to be quick. She's very, very booked today. So I actually begged her to be in this program. So Laurie shows her clients how to stay informed and protect their license so they can do their job with confidence, focusing on serving the patient and regain the joy in the profession. So I'm going to find Laurie now and make her a host, and she's going to start talking to you guys. I want you to listen attentively to Laurie. She's got a lot to offer. She got a lot to tell you today. So listen attentively. I'll keep on allowing other people to join us as we progress. But please, please, please listen attentively, and Laurie is going to give you that tip, that secret with life experiences that she's had as an attorney of people who come into this country, even new nurses, new registered nurses coming into this country to practice are going into cases. I've heard several, but that is not to, make you to be afraid. I'm just letting you know so you can know how to protect your license. So Laurie, I've made you a host. I think you can share your screen now. Hi, Laurie, you're welcome to the program.
Thank you. Thank you for having me. I'm really excited to be here, finally. So I'm
Finally,
honored.
yes.
Yes, and I would love to see all your beautiful faces. So please turn your cameras on. This can be the most impactful program if you let it. So I'd love to see you. This is class participation. This is not some boring lecture. And I'm going to teach you how to protect your most valuable asset, your license, because you work too hard for it. And I can tell you, we have over 100 clients at, usually at a time, 100 nurses who are afraid they're going to lose their license with active cases. And I don't want you to be one of them. So I'm going to teach you a system of how to protect your license, which could be life-changing for you. So I do want to make this very interactive, and I'd love to see you. So please turn on your cameras. I'm going to ask questions, and I'd love to see your answers. So welcome. Okay, so we're going to get started. 7,000 nurses every year are disciplined before the boards, and this is a very old statistics. This is from like 2004. So I don't have a more recent statistic about what it is now. But if you think about 7,000 nurses, that's probably more nurses than in your hospital. It's crazy. So many are getting in trouble. And of course, we don't want that. So, so in a 15-year period, 956 patients underwent surgery on the wrong site. Can you believe that? All these patients had surgery on the wrong site. But here's the most interesting part about it. At least one person in the operating room knew that they were operating on the wrong site and didn't say anything. And this happens all the time, and it's scary. So nurses, we have to stand in our power and speak up. We are the ones who get to make changes in healthcare. Nobody else can do it but us. We are the largest workforce, but have 0% of the power. But if we speak up and stand in our power, we can make the changes to improve our profession. So let me tell you why I got the privilege of speaking to you today. So back when I was 10 years old, I fell off a horse, and I hit my head, and I was, this is actually my daughter, and when she was about 10 years old, and I hit my head. And when I came to, there was this woman standing there all in white. I was at overnight camp, and she scooped me up and took me to the hospital. And once I felt better, I said, you know, how do you like being a nurse? What's it like? Why do you like taking care of kids? What do you do all day? How do you make people feel better? You know, I had a million questions, inquiring minds, right? And that day I made a very important decision. That day I decided to be a registered nurse. So how many of you have had somebody in your life who inspired you to become a nurse? Anybody? Yeah. Again, I'd love to see all you, because this is very interactive. So I'd love to know, and feel free to write in the chat too. Who inspired you? Who was your the person that really impacted you, that you decided to become a registered nurse? I believe that it's a calling. It's in our DNA. Nursing is in our DNA. So so I would love to hear from you. Who inspired you? Just put it in the chat, or a couple of Juliet, Anita, raise their hands. Yeah, I'd love to see. I'd actually love to see your beautiful faces too. Okay, so I couldn't wait to get my white cap. Yes, this is me back when back when the dinosaurs roamed the earth. I got my white cap and my pin and became a registered nurse. And I was new, I was green, I was terrified. I'm sure many of you feel like that. Even if you were a nurse in another country, coming to this country, being a nurse is very, very scary. So I decided to move to California, and I had interviews with 7 hospitals, and I had 7 job offers. And I took this job at this hospital. It may not look familiar to you, but this is was on the trailer of a TV show years ago called Marcus Welby, MD. And Marcus Welby was just a sweet, kind doctor who made house calls. And he was amazing. He would make people feel better. And I thought, well, gosh, if there's doctors like him at this hospital, I'll be in good shape. And then he had this really adorable associate named Dr. Kylie. And I thought, well, if there's doctors like that, that'll be great too. But I didn't meet my Dr. Kylie. But anyways, I worked at this hospital, and probably a couple of weeks into working there, a patient coded, and I was absolutely terrified. And I was saying, thank God it's not my patient. So I went ahead and I was watching all the other nurses' patients while they were handling the code. And one of the nurses stepped out and said, can you please call can you please go to Central Supply and get this piece of equipment? It was Gomco suction. Now, nowadays, suction comes out of the wall, but back then we had this cart that we had to wheel up. And so I remember being in the hall, calling Central Supply, asking for this life-saving equipment. And you know what they said to me? They said, we don't deliver.
Oh.
I was devastated. I'm like, this man is coding and you're not delivering this equipment? Well, apparently everybody else in the hospital knew that they didn't deliver, but me. And here I was new, scared, watching my patients, watching everybody else's patients, and this life-saving equipment. The one thing they asked me to do to save this man's life, they wouldn't deliver. So I went down to Central Supply, I got the equipment, and the next day, my unit manager called me in her office and said, Lori, I have to tell you something, I have to write you up. And I'm like, what? Are you kidding me? And she said, I need to write you up for the way you talk to the person from Central Supply. And I'm like, I was just advocating for this patient. And I was, if you've ever been written up, I was just so devastated. I couldn't believe it. I felt so alone and unsupported, and it was like this deep, dark, dirty secret. And I figured that if I kept my mouth shut and fly under the radar, then I wouldn't get into trouble. But I also blamed my unit manager, because I felt that if my unit manager had supported me, that why would she allow nurses to have to go to Central Supply to get this equipment? I just couldn't believe it. So I decided, well, I'm going to become a unit manager, and I am going to support my staff and be there for them, and use them efficiently to give the best patient care, which does not mean running to Central Supply to get equipment. So I got my master's degree, and I have a master's in clinical nurse specialist, med surg, and nursing administration. And then I went to law school because I was a unit manager. And what I realized is that if you don't comply with upper management, then you have to leave. And so that's why I went to law school. I felt I could be a better advocate for nurses outside of the nursing profession by being an attorney. And now I feel like I have the best job in the world because I represent nurses before the licensing board. And it's like I said, I feel like a nurse for nurses. So I've represented over 1,000 nurses before the licensing board. And I figured if I could come up with what they have in common, I can help you protect your license. So that's why I came up with Empowered Nurses. And I created a system called GIFTS. And GIFTS is an acronym. So I'm going to go through each one of these, but let me just share with you up front what they are. The word G is for giving. The word I is for integrity. F is for focus and follow through. T is for trust. And S is for source. So if you use your gifts, you will be able to protect your license, speak your mind, stand in your power, and be a change agent to improve patient care. So who would like to learn about the gifts? Anybody?
Yes, I would like to.
Okay. Awesome. All right.
So can we all hear her just a little? I just want to do a mic check. Can everybody hear Lori? Can everyone hear? All right.
Yes, we can.
Good, good. Okay, we can mute. All right, we can mute ourselves back and keep listening. If you want to respond, please use the text message. That's the chat button. Respond to her so she can know we are following. Okay.
Yeah, because we're going to get very interactive really soon. Okay. You
All right.
guys are going to be the board, and you're going to tell me what you would do for this person. All right. Okay. So the G is for the word giving, and naturally as nurses, we're giving to our patients, but we're not necessarily giving to each other. In fact, there's so much lateral violence and stuff in nursing. It's really sad. And we get to be giving to everybody, and giving to physicians, giving to administration, giving to everybody. So, and that means giving to yourself. And as nurses, we are better off giving to everybody else than ourselves. We kind of put ourselves last, and no more of that. In order for you to be an effective nurse, you've got to put yourself first. No more taking that, the fifth double in a row because there's nobody else. No more of that. That's when mistakes happen. So you get to take care of yourself. So you fill your cup, and you're able to fill your patient's cup. Help them get better. So I'm going to explain to you giving in the best way I can through a story. And this is Harley's story. And Harley was a nurse working in a subacute ventilator unit. And he worked at the nurses, well, the nurses station was like U-shaped. And he sat on the side of it and he was charting, and he could look down the hall and see if any of his patients' lights were on. So when a call light went on, it would be very slow, like beep, beep. But when an alarm light came on for a ventilator, like if the ventilator became disconnected or the O2 saturation monitor came off, any of those things, the alarm would be very fast. Beep, beep, beep. So he heard the beep, beep, beep. He looks down the hall. None of his patients none of his patients' lights were on, or the alarm lights. And so he went back to do his work. And then he kept hearing the beep, beep, beep. And and then it stopped for a couple minutes, a couple seconds maybe, and it started again. So he turns around, and then other nurse at the nurse's station, he said, "Is that your patient? What's wrong with the alarm?" And she said, "Oh, it's fine. I'm taking care of it." So he continued to chart, and he kept hearing the beep, beep, beep. And he finally turns around and he says, "Look, we need to figure out what's going on because this alarm's been going off for a while." And everything was fine, fortunately, but in the hall, they had video monitors, and everybody who did not answer that alarm light was terminated the next day. So he lost his job because he didn't get another nurse's alarm light when the nurse told him that she was taking care of it. So that's how easy it is to lose your job. And in addition, he got reported to the board. So the licensing board can do one of four things. First is they can give you a reprimand, a slap on the wrist, don't do this again. Second, they can put your license on probation, that they want to watch you to make sure you're safe. Third is they can suspend your license. And fourth is they can revoke your license. So they can give you a reprimand, probation, suspension, and revocation. So who thinks, and I want you to put your vote in the chat, who thinks that Harley got a reprimand, a slap on the wrist, don't do it again, for not answering another nurse's alarm light? Put it in the chat. And you can put REP for reprimand if you want to shortcut it. How many of you think he got probation? Just put a P if you think he got probation. Put a P in the chat. How many of you think he got his license suspended? Put an S in the chat if you think it was suspended. And then if you think it was revoked, put an REV. Okay, so we got a reprimand, we got probation, a reprimand. What else? We have 3 votes out of, I think there's a lot more people than 3 here. So who's not playing? 76 people. Reprimand, suspended, okay. All right, so first of all, Harley actually got probation for 18 months that will be on his record forever. There's no way to get that off of his license. It will be on there forever. No matter what discipline they gave him, it will be on his license forever. And the second thing I wanted to say is that these nursing units have cameras all over, and not in patients' rooms, but they have them all over. So anything that you do, I think you should act as if you're on camera, because you never know who's watching, and you should be in integrity and be the same whether you're on camera or off camera. So now Harley has to report that he was terminated on every license or every job application he's got. Every job application. You can't leave it off your resume, you can't leave it off your application. And he's got this board matter that's going to follow him for the rest of his career. So it's really sad when, just for not answering the call light or the alarm light of another nurse's patient who is sitting right there. So that's what can happen. Now, let's use our gifts, okay? Was Harley giving to all the patients on the unit? How many people say yes? Put yes or no in the chat if you think Harley was giving to all the patients on the unit. Just pop it in the chat, yes or no, Y or N, if he was giving to all the patients on the unit. Okay. So many of you are saying yes. A couple of no's here. Yeah. No, Harley was not giving. He gave to his patients, but he didn't give to every patient. So it's not just your patient or her patient. They're all our patients. And every patient on the floor is your patient, whether they're assigned to you or not. So, Harley immediately should have gone and checked on that patient, whether that other nurse was going to or not, because all patients on the floor are his patients, even the ones that aren't assigned to him. Okay, so now we're going to talk about the I. The I is integrity, and the I is important in terms of documentation. It's really important that you document everything and be truthful in your documentation. There was a nurse just recently in Pennsylvania. I know you probably talked about RaDonda Vaught, right?
Mm-hmm.
There was another nurse who was taking care of a patient by the name of McMasters, and he was actually the press secretary for President Clinton. He was in a nursing home and fell and hit his head, and neurochecks were ordered. And this nurse documented that she performed the neurochecks every 15 minutes as ordered, but the video showed that she never even went into the patient's room. And so she lied on the documentation and just pled guilty now to a criminal charge of that. So it is so important that you be in integrity and be honest and ethical in your documentation. It will save you every time. And also doing what's in line with what matters to you. So if it's important to you to take care of all the patients on the unit, then you take care of all the patients. If it's important to you to be kind to people, then you be kind. Don't do anything that's out of alignment with what you believe, what your core values are. Okay, so this is a story about Amber. Amber was a nurse in the emergency room, and a patient came in with abdominal pain. And the doctor was busy with a trauma patient. And so her supervisor says, oh, well, whenever a patient comes in with abdominal pain, we go get a flat plate of the abdomen, start an IV, and get a CBC and Chem 12. So her supervisor told her that, and she did it. She didn't have orders. The doctor never saw her. She was practicing medicine without a license. And she felt like she was in between a rock and a hard place because her supervisor told her to do this. She was a new nurse, and yet she didn't have any orders and the doctor hadn't seen the patient. So her and her supervisor both lost their job and for practicing medicine without a license. Now, the board again can give you a reprimand, slap on the wrist, don't do it again. They can put your license on probation. They can suspend your license and revoke your license. So what do you think the board did? Did they give her a reprimand? Just put REP in the chat. Did they give her a probation? Put a P in the chat. Suspension, put an S in the chat, and revocation, REV, where they take away your license permanently. So what do you think they did for Amber? Anita says they revoked her license. Okay, we got a revoked, a probation, a suspension, a revocation, reprimand, a probation, revocation, suspension. Okay. Anybody else want to weigh in here? Revocation. Okay. So they actually put her on probation. She was a new nurse. She was in a rock and a hard place. Her supervisor told her one thing, and even though she thought differently, she did it anyways. So don't let your supervisor or anybody tell you something that you don't feel is right. Be in integrity about it and ask. So I had a case very similar to Redonda Vaught, where a nurse was a med-surg nurse, never went to the emergency room, but got floated there. And there was an order for a GI cocktail and then to send her home. He had never given a GI cocktail before. So he asked the other nurse in the emergency room, well, what's a GI cocktail? So she takes him over to the Pyxis and she points to boom, boom, boom. And a GI cocktail is usually like Maalox or Mylanta, something, and then Valium. And so she gave, so this nurse gave Vecuronium instead of Valium, because that's where she thought they were, where that other nurse was pointing. Now, when the patient became paralyzed and was starting to have trouble to breathe, luckily he caught it and realized his mistake. But that's how easy it is to make a mistake. So if you don't understand what the medication is that you're giving, don't give it. He should have never gave a GI cocktail if he didn't know what it was. And to think that you're following the nurse when she's pointing to the things, it doesn't work. Now, luckily, he only got a reprimand. He didn't, lose his license and get criminal charges. But that's how easy a mistake can happen.
Mhm.
Okay, so the next area, which is the most common mistake, and that is focus and follow through. Focus and follow through is the number one area where nurses make mistakes. So why do you think that is? Why do you think so many nurses make mistakes because they're not focused or following through? It's because we're distracted. We get new information every 5 minutes. And so this is the story of Bonnie. Bonnie was giving a G-tube feeding, and there was a bolus and then a basal dose. So she was supposed to give like 100 cc's right away, and then slow it down to, like 20 cc's an hour. And so she's given the bolus and she's watching it, and a CNA comes in and says, Bonnie, you need to see this patient right now. And she left what she was doing and went to see the other patient. And that whole tube feeding entered this person's stomach, and they started throwing up and having to go to the emergency room. So because Bonnie was interrupted, and instead of staying focused on what she was doing, she could have said, what is wrong with this other patient? Let me finish this and I will go see. But instead, she listened to the tone of the CNA's voice, didn't ask any questions about it, and just ran out and left what she was doing. So it would have taken 1 second for her to turn off that tube feeding, or it would have taken her 1 second to say, tell me what's going on, but she didn't. So it's really important that you stay focused and follow through. So how many of you are focused and follow through this morning or afternoon, wherever you are in the world? Okay. Okay, so I'm going to show you a sentence on the screen. You're going to read that sentence and count the number of F's in the sentence and put the number in the chat, okay? So the top line of the sentence says how many F's are in the sentence. That F doesn't count, that's the directions. So you're gonna count the number of F's and put the number in the chat, okay? Got it? All right, here we go. How many F's are there? Don't count that first F, but in that sentence that starts with finish files, count how many F's there are and put it in the chat. Okay, great. They're coming in. How many F's are in the sentence? Put it in the chat. Okay. All right. So as you can see, we have numbers all over the board. We have everywhere from 2, 3, 4, 5, 6. Everybody has a different number, and there's only one right number, right? So how can we have all these different numbers? And the reason is that there are actually 6 F's. The reason why we don't see the 6 F's is because our brain interprets the of as a V. Even though it's an F and you're looking at the F right there, your brain is saying, oh, it's a V. Okay, so see how easy it is to make a mistake and see something that's right in front of you. You've got an F, 3 F's right there, but you don't see them. And that's exactly what Rodonda Vaught did when she's looking at the medication. Her brain is thinking this is the right medication, and she's looking at the wrong medication. So that's why focused and follow through is so important. Okay, so you ready to try again?
Yes.
Okay, all right. So I'm going to show you a sentence, and just read the sentence. Okay. Okay, so how many of you read I Love Paris in the Springtime? Write yes in the chat. If you read something else, put no. Okay, yes if you read I Love Paris in the Springtime, no if you read something else. Okay, most of you saying yes. A couple of no's. But it does not say I love Paris in the springtime. It says I love Paris in the springtime. Isn't that crazy how our mind plays these games on us, and what we think we see isn't actually what we see? Okay, so are you ready to try again?
Yep.
Okay, all right. So this time I'm going to show you a video.
Okay.
Oops, it says host disabled screen
Okay.
share.
I'm going to do it again. I was trying to let people in.
Oh, you can just make me a co-host. That'll work.
Okay.
Yeah, there's more people now. All right, so I'm going to play you a video. If I can pull it up. I'm going to play you a video. And on that video, your job is to count the number. It's a basketball game. And you're going to count the players in the white shirts. How many times the players in the white shirts pass the ball. All right? So you're going to count. Ready?
Ready.
Count how many times the players wearing white pass the basketball. How many passes did you count?
How many passes did you count? Put it in the chat. Okay, again, we got numbers all over the board. And there's only one right number, right? So do you think looking at it again will help you? You want to look at it again? See if it'll help?
Maybe.
Let's try again. All right, just let's try again.
How many passes did you count?
So put your number in the chat, and if it changed, put a C next to it. Just
There were some that they did like this. Why?
yeah, if your number
Yeah.
changed, put the number in it and a C next to it to see if it changed.
It's over 11.
Okay, lots of C's. And the reason why I show this to you twice is because get a second opinion. You think you know the answer and it's right in front of you, but you may not. So get a second opinion. So
Correct answer.
I knew it's more than. Do you know why? Because the way they were passing.
could somebody mute themselves, whoever's talking?
Yeah, can we all mute ourselves, please?
Okay, so there were 15 passes. But the question is, did you see the gorilla? We are so busy looking at the white shirts. This gorilla pops in right in the middle of the screen, beats his chest, and walks out. And many of us
This
miss
video
it.
is from research by
So again, it's just to show you how important the focus and follow through is. And if I can share my screen again.
For some reason, it doesn't let me co-host. It just makes hosts.
Oh, let me try then. You
Yeah.
Did you make me host?
Yes, you can share now.
Okay.
The remaining 9 meals will be from
You're going to keep it. You just use plaster to.
Yeah, whoever's not muted, if you can mute, please.
man waits,
I appreciate it.
No,
Okay,
to waste has to waste a minute.
Okay. No, just reclaim the host and mute everybody. We have 100 participants. It's kind of difficult to control sometimes, but we'll try. All right. So we are all mute now. And Laurie, you can unmute yourself, please.
okay. So the T stands for trust your gut. Your gut always knows. For those of us who are parents out there, you walk into your child's room and you know in a second when something is so trust your gut, because again, you walk into a patient's room and you know in a minute if something is wrong.
And a bite.
So again, if you could mute yourself, I'd appreciate it.
Okay, Laurie, let me try and mute everybody. You can unmute yourself after this, okay? Sorry about that.
Okay,
Yeah,
so
go
the
ahead.
T is for trusting your gut. And how many, I know you've all had that experience where your gut is telling you something, you go take vital signs, everything is fine, but you know something is wrong. And then a couple minutes later, something bad happens. Your gut is there for a reason, and don't talk yourself out of it. And you're like, well, I can't call the doctor just on this gut thing. Get a second opinion, because it is so important to trust that gut. Okay, S is for source. You are the source of everything that happens to you and your practice. And it's not from a standpoint of fault or blame, but it's a standpoint if I'm the source, I can do something about it. So if you're one of those nurses who are like, well, if I only had a better assignment, that wouldn't have happened. Or if my charge nurse had helped me, it wouldn't have happened. Or if we weren't short-staffed today, or if I didn't have that one patient again, we blame everybody. That's our society. Our society is all about blaming. But when you blame, you can't do anything about it. So by being the source, you can come up with the solution. So for me, in that situation that I told you about with where they wouldn't deliver the equipment. First of all, I was not giving to the person on the other end of the phone. I was advocating for her to bring me that equipment, and she just didn't. And no means no. And I could argue with her all I wanted, but that was not going to get that patient's equipment up any faster. I being in integrity, I was really, pleading with her to bring that equipment. I was not being in integrity with myself by pleading. I was not being focused on follow through, because the time it took me to beg her to come with the equipment, I could have been down and back in that time. And I should have trusted my gut. My gut was saying, she's not going to deliver this equipment, go get it. Instead, I wanted to be right and have her bring me the equipment. And then being the source, I was not the source that day of getting that equipment fast, because I was too busy pleading with her on the phone. Had I gone to get the equipment and the next day just used my gifts, all of them, and went to my supervisor and said, I know how valuable you feel your nurses are, and I know you want us to be there taking care of the patients. Well, we encountered a situation yesterday where Central Supply didn't deliver. I'm wondering if I can partner with you to maybe have an orderly or a volunteer or somebody who can deliver the equipment so that nurses can be there taking care of the patients. Could you help me make that change? It would have been a completely different outcome. So remember to use your gifts when you want to make change, because they will help you. Now, lastly, this is the story of Amber, who made a change where she worked. She was a nurse working. Actually, this isn't Amber's story, so I'll tell you Amber's story first. Amber was a nurse, a student nurse, working in a hospital, and she was working night shift, and her coworkers were all like, you should get practice giving meds so that when you graduate, you'll be ready to go. Excuse me. And she knew that she wasn't allowed to give meds as a student nurse, but she wanted to help the other nurses and to get that experience. So she did it. And she was not using her gifts, because she was not giving to herself by doing something outside of her scope of practice. She was not being in integrity because she knew it was wrong to pass meds as a student. She was not being focused and follow through. She didn't trust her gut, and she wasn't the source. Now, Amber did get called before the board, but they couldn't do anything because she didn't have a license at the time. But can you imagine if they did, how that would have started her career? So remember your gifts. It's not easy to remember them because our society is one of fault and blame. But if you can just go through in your head when you have a situation, okay, am I giving to everybody? Am I in integrity? Am I being focused and follow through? Am I trusting my gut, and am I being the source for this situation? I promise you, it'll make a huge difference in your career. But it does take practice. Again, it's not something you learn and that we're taught to do. So here's Heather's story about how she made a change. Heather was working on a psychiatric unit, and every Thursday the students would come and the nurses would sit and complain about these students and say, oh, these students don't know anything. They take so much more of our time. I would rather just do my job and not have to worry about a student who They're not teaching right in nursing school, and they would every day every Thursday they'd complain, and Heather's gut was just screaming at her like, oh, this is awful. And she decided, well, I'm going to say something. So she said, how would you feel if you heard this, if you were one of the students and heard this conversation? And every one of those nurses turned a shade of blue, and they're like, oh, this would be awful. I would hate to hear us talking about it. And she said, these students are going to be working with us side by side in a few short months. Let's help them now to be the best nurse they can be. So when they start working with us, they're going to be a great asset to our team. And from that day forward, nobody complained about the nurses. They all helped each other and help those students to be the best they could be, even if their education wasn't as good as they wanted. But they partnered with them and they helped them be successful. And so that's the biggest giving that you can do, is to help another be successful. So always remember your gifts, and you can be part of the solution or part of the problem. The choice is yours. I'd rather be part of the solution. I'd rather come up with ideas on how to improve our profession rather than complain about what's wrong with it.
Yeah.
And we're always a nurse in progress. We're always learning. We're always downloading. It's a practice. It's not a perfection. So if you'd like more information, feel free to follow me at empowerednurses.org or on my Facebook group, or I don't do too much with Twitter these days. I also have a new book coming out called What They Don't Teach You in Nursing School. It's coming out May 9th. So mark your calendars, because for that one day, May 9th, every one of you can get a copy, the Kindle version of my book, What They Don't Teach You in Nursing School, for 99 cents. The next day, it'll go up to $24.99. So if you want that book for 99 cents, just mark your calendar, go on Amazon, What They Don't Teach You in Nursing School, or look up my name. You can get the Kindle version for 99 cents. So thank you so much for listening and being a part of this. I'm happy to take any questions.
All right. Thank you so much, Laurie. We really appreciate you. That was very impactful. And those games, I failed some of them. I failed some of the games because I couldn't really figure out how many times they pass the ball and all that. I know we have a lot of people here, and they come from different parts of the world, and we have different questions regarding different area where we come from. I believe Laurie will be able to take some of those questions. She'll be able to answer them, but we might not take all. So as many of the questions that we can take today, we can. But what I'm promising you is that I'll continue to disturb and bug Laurie to come back again, to come and talk to you again before this year runs out. I'll bring her back again on another topic. So, but for today, if you have any question, you can please raise up your hand. Just show me that hand sign that is raised up, and I will call your name. Then you can unmute yourself and ask your question. That's how we're going to take questions. And I want us to be orderly. I want us to be very orderly so we can hear ourselves. Be straight to the point, ask your question, then we will respond to you in a timely manner. Thank you very much. I have Catherine. Catherine, you can unmute your phone and ask your question. Hello, Catherine. Hello. If Catherine is not ready, we will take a question from there is no name to this, but it just says iPhone. If you have an iPhone and your hand is raised up, you can unmute your self and ask your question. So while we are waiting for that to happen, I just want to find out from you, Laurie. Rodanda, what is the update on her case? Because I know most people here may not really know about that case. Can you give us a little brief about Rodanda and a little brief on what the update is about her sentencing and what the judge decided to do about her?
Okay, so Rodanda Vaught was found guilty of 2 counts criminal charges. The first count was for negligence, my brain is not remembering. 2 counts. One is for like negligent, it'll come to me. Anyways, she was found guilty, and the next step of a criminal matter, she already lost her license. Her license was revoked. And so the sentencing hearing will be on May 13th. 200,000 people, probably mostly nurses, asked the governor of Tennessee to give her what's called clemency, and he refused. Clemency is meaning that she won't get any sanctions. Now, the judge can put her in jail, in prison for, I think it's up to 12 years.
12 years, I heard that. That's the least. That's the least
Yeah.
I should get.
And her sentencing hearing will be on May 13th. However, my hope is they give her home detention, if anything.
Yeah.
That they give her home detention and let her, instead of sending her to prison for just doing her job, albeit negligently. There's no question about that. I think it's malpractice, but it is not a criminal matter. And
Exactly.
the American Association of Nurse Attorneys is writing a position statement on that.
Yeah. I really don't think it's a criminal matter. I really don't even think that should have gotten, because this thing happened like 1 year ago, right? This thing like
5 years ago, 2017.
5 years ago, and
5
it's
years
just now because some hospital wanted, a scapegoat, then they decided to use her. Honestly, I didn't feel like it was a criminal offense, but you guys in the law field know more than me. I don't know much, about law, but she was just doing her job, and she really reported that incident. I know as nurses, we all know about the 5 rights of our medication. It has to be the right patient, the right drug, the right route, and everything. She missed it. She gave the wrong drug to the right patient. But after doing that, she realized what she did and reported to the appropriate authority. But it seemed like that report came in late because damage has already been done by then. And what else, since then, the license, she was practicing also after that. So that's another thing I'm asking myself. Why do you let her practice if she was eventually going to get to this place where she is currently? But it's all good. So we have Uchenna, Enete Uchenna. If you're ready, you can unmute yourself and ask your question. And let me check to see if we have other people asking questions on the chat room.
And I charge $500 an hour. You're getting this for free. So whatever questions you have, ask away, because I'm happy to help.
Yes.
Or you can come see me and pay me, your choice.
We don't want to do that. That's when things get worse. That's when we have to look for you and, start paying to get you and start finding. Mary Ann, go ahead. Unmute yourself before you. People in Nigeria might be having a little bit of challenge, and also it's kind of late. So when you were requesting that people unmute, on their camera, it might be kind of dark where they are. So that might be the reason why you didn't have a lot of people that use their camera for the program. But Uchenna, I can see you unmuted yourself. So go straight to the question. We'll take you and Mary Ann together. So after Uchenna, we'll take from Mary Ann, then Laurie will respond to both of you.
Hello?
Yeah, Uchenna, go ahead.
Good evening. I just joined now. I was just trying to see if I can follow. I don't really mean to ask a question.
Okay, so I'm recording this event because this kind of event doesn't happen often. So I'm recording it, and I will share the link so you can watch it and ask. And I watch it at your own convenience. And if you have question by then, and I believe it's something I cannot answer, then we'll have to wait for next time we get Laurie, or you pay $500 to talk to her for 30 minutes. All right.
Thank you.
All right. Thank you, Chenna. All right, Miriam.
Hello,
Yeah. How are you?
good evening, Mr.
Good evening.
Desensi,
How are
and
you
good
doing?
evening, Laurie. I'm very happy to be in this Zoom program. Well, I just want to thank Laurie for opening our eyes to things happening in the US as a nurse, for you to practice as a nurse, what that you just have to do. Where I would say I'm not really clear is the F, which is focus and follow through. Like if you are attending to a patient, and maybe your supervisor came and said, oh, Marianne, you have to go and see so patient in room, so and so. And maybe your supervisor wants you to see the patient immediately. But because you want to be focused and to follow through, you want to be true with the first patient, and you spend some time before going to see the patient that you were asked to see. Won't your supervisor say, okay, you are wasting time, or you didn't obey instructions? Because there are some scenarios that you can't even leave your patient that you are attending to immediately.
It's all
And
about
so, okay,
communication.
you are not quick to respond.
Yeah, it's all about communication. So can you say to your supervisor, look, I'm just finishing this up. It should take me like 5 more minutes, and then I will go take care of that. Is that okay with you? It's just
Okay.
communication. Yeah. And like had
Thank
that
you.
nurse communicated with the CNA and said, well, what is the problem? Can I finish this? You know, she would have had a different experience.
Okay, so I just want to give a little more insight to that. So if you find out, suddenly you're standing on the hallway and you find some people running, would you join them to run or ask questions to find out what direction you want to run to? So the best thing to do is to ask questions, find out what direction you want, because you might run to the target. If it's an active shooter, for example, and you start running, you need to find out. And it doesn't take much for you to say, what is happening? And then you can now decide on what best to do. So it's just like that very person that the CNA called, you would have, if you just said, what is the problem? Can I finish this? Is it a life-threatening situation? You know, you try to ascertain the situation before you can actually, take action. Because you have to, as a nurse, one of the things I teach you all is that you have to do your assessment first. Whenever you are presented with any situation, you assess. So whenever you are presented with any situation, you have to assess. Assessment can come in form of question. What is the problem? How can I help? Then you can now find out what you are going to do. All right, Marianne. Okay, Joy. Joy, you can unmute yourself and ask your question. I hope, Marianne, we answered your question.
Yes, it has been answered. Thank you.
You're welcome. All right, Joy. I will take Joy, we'll take Jackson and Uchenna, and that will be the end. Okay?
Okay, so I just wanted to thank Ms. Laura for her time. I really gained a lot. I have a question. It's not really, well, it's something that's been bothering me. I just said, let me ask. Let me give an instance. Let's assume you have a license to do your CPR, and maybe you're in a restaurant and someone just, there's a situation that you have to rescue that client. What if you go and do it and you don't do it right? Are you going to be held accountable for not doing it right or something? I'm just asking a question.
That's in
Or
my
is it
book.
better to just walk away if you're not sure of what to do? Or you go and do it and you not do it right? What's going to happen?
That's in my book. Normally, most states have like a Good Samaritan law, that if you come across a person in need and take care of them, then you're usually covered by the Good Samaritan law. Now, that doesn't mean they can't sue you, but that means that you can get out based on, you can ask that the case be dismissed based on the Good Samaritan law. Because like I was on an airplane and somebody was getting sick in the bathroom and they were asking for any nurses or doctors and nobody was responding. And so I said I would help. And then luckily another nurse came after me. But they wanted us to, they talked to the ground and they tell us what to do. And they wanted us to start an IV and give her fluids because she was, lost so many fluids. And I'm like, I haven't started an IV in a long time, but yeah, you're definitely covered by the Good Samaritan law. But speaking of which, that's an excellent question because I always get asked, should I carry my own malpractice policy? And I used to say, it's your choice. It's a personal decision. Now I say yes. And the reason why is because just like when you have your own policy, as long as it has professional licensing defense, you are entitled to your own attorney. And if all those nurses that went to the board that we talked about, none of them had the insurance. And if they had the insurance, they would have been reimbursed a portion, if not all of their attorney fees. So I am a big advocate now of insurance, as long as it has the professional licensing defense. It's very cheap. And to be able to have your own attorney and to be able to call and ask questions, many of them have risk management departments. It's like, having your own attorney and retainer.
Okay. Thank you very much, Laurie. And that was Joy. Joy, I hope that answered your question, correct?
Yes, it did. It did.
All
Thank
right.
you.
All right, then Jackson. Jackson, you can unmute yourself and ask your question.
Okay, thank you, Decency and Laurie. I'm happy to be here with you guys tonight. I really appreciate the explanation so far. My question is similar to what this person, I've been cleared anyway, is just about making a decision when it comes to maybe there's an incident and you are in a situation whereby you can decide to help or not if there will be a problem, like what this lady just asked. So, and I think I've been cleared. I'm fine. But another question I would like to ask is actually out of what we are discussing here tonight. I don't know. I think I'm going to send that one to you separately because it's totally out of what we are discussing tonight.
Okay.
I have a concern, but I think I'll send that to you. Okay.
All right. Okay. So you can reach me on my cell phone. I'm available today all day, so we can discuss and have that sorted out. Okay. So I have a question, Laurie, that I really need to read out. It's in our comment section. By Mercy. Mercy said, what can you do when you are really busy with a cohort of patients? You have a deteriorating patient as well. Focusing on the deteriorating patient made me not to give meds to the other patient. Now I'm having issues with my manager. So now what can Mercy do? She's busy and she couldn't do other of her roles. We all know that sometimes it gets so crazy in the hospital. That's why nurses are on the receiving end. If it gets so busy, you have 6 patients, sometimes 7, 8 patients to care for, and all of them are due for medication at a certain time. And you don't get to give those medication at that time. It can cause those patients to have some adverse effects. So now Mercy is in that kind of situation and she's asking, what can she do?
So you need to, at the time, when you're with that deteriorating patient and you have to give meds, you got to call and get help. You got to let somebody know that you couldn't do it on time because you can't be in 2 places at once.
Yeah. You
got to let your charge nurse know what's going on instead of just forgetting about it. So it's communication again. It's letting somebody know, hey, I need help. This patient's deteriorating. My patients need meds. I can't do both. Who can help me?
Good. So you have to speak up. You just have to speak up, Mercy. If there's any situation that will make you not deliver your care, call that your manager on time and say, please, this is what I'm into right now, and I need help. I need somebody to be able to take up my other patients so I can concentrate on this one. But Laurie, now that the incident has happened, what can she do? Does she leave her job because her manager is not okay with her? Or what is the best way to approach this? Should she write an apology letter to the manager or go in person to explain to the manager why she couldn't do those things? What approach can she use in this situation?
So I always say it's better to quit than to get fired. So if you think, because when you get fired, you've got to report that on every future job application. So if you feel like you are, if she's going to fire you, then just quit. If you think, if you can partner with her and say, look, I was in a really difficult situation. I was with a patient deteriorating and I couldn't get my meds done. Can you help me learn from this situation, and partner with her to get educated, and see if she'll work with you on, well, what do you do when you feel like you're in a rock and a hard place and can't do everything? And if she will work with you, great. And then, but if she won't, or like, for example, my situation where I was talking to the person from Central Supply, how do you advocate for a patient without, alienating somebody else? And so I wish they would have gave me education on communication, but they didn't. So what kind of education can they give you to help you with your decision-making?
Good. All right. I hope that answered your question, Mercy. So Deborah, we are really running out of time. I know why I'm saying this. So please kindly go straight to the point and ask your question. Laurie, is that okay for us to take 2 more questions?
Sure.
Okay, good. All right. So Deborah, go straight to the point and ask your question. And if you have been answered, okay. Mary Ann and Uche, if your question has been answered, no need raising your hand. You can lower your hand so I can know how many more questions we have.
All right. Thank you, Disensi. Thank you, Laurie. My question is this. In a situation where you happen to resuscitate someone who has a do not resuscitate, in this situation, what's going to happen to you? You're not aware of it, but you went ahead and you resuscitated that patient, and that patient sees you. In this case, what do you do?
We get both of those, that you resuscitated and you shouldn't, or you should have resuscitated and didn't. And I think, first of all, the hospital needs a better system to notify people if they're a code or not a code. And, if they weren't properly identified as a no code and you did CPR, you should be okay. But it's really considered battery to resuscitate somebody who shouldn't be resuscitated. But what are the damages, because you know what I mean? If you broke lung or broke ribs or something, that would be an issue, but it's really based on damages. And then same with if you don't resuscitate somebody that you should, that's a problem too. And the boards don't like that. They expect you to, to know whether a patient's a code or not. So the hospital needs to have a system so that you know whether to resuscitate somebody or not.
Okay, what if it happens outside the hospital?
Like home health care or?
Yes, or you're in a restaurant, or you just bump into them and you just decide to help.
Well, again, if you run into an emergency and you do CPR, you wouldn't know code status. Was their family there saying not to?
No.
I think you have a duty to do it.
Also, I think some of them do carry some cards, like a card in their pocket or in like an armband, like do not resuscitate armband or a card. If you have chance to check, you can check their pocket to find out if they have. But if you do not, Laurie is saying, not me, that you are in that position to help and you helped. So I think the Good Samaritan law should be able to protect such person, right?
yeah, it would help you.
Okay, good.
And then
Okay, all right.
there are some states where if you're a nurse, you have an affirmative duty to help somebody in need too. You can't walk by them. So just know what your state's law is, whether you can walk by or not.
Right.
All right. Thank you so much.
Sure.
And the last person for today to ask question is Favor. Favor, do you have a different question from what has been asked already?
Yes.
Okay, go ahead.
Thank you, Lauren and both decency. My question is
Right.
that, is there any condition or you will leave a procedure to attend to a patient? Because there is a question I saw and in my mind, you were like, you cannot leave a procedure to attend to another patient, you will finish up. But this question says that a nurse is attending to a patient, a bed bath, giving a patient bed bath, and an attested personnel came and called the nurse that another patient assigned to that nurse is having pain. They say in that condition, what should be the right thing for the nurse to do? But I was surprised when they answered that the nurse will take excuse, cover the patient to go and attend to that. I was really confused. That's why I want to ask you. Second question goes to both decency directly, that in this our journey to US, must we need agency to get to work in US? That's my question.
Okay, so I will let Laurie take her question first, and we'll coming into that, Laurie. A little bit of what she's saying is that she saw a question, but this is an endless question, I suppose. And the question is saying that a nurse was given a bed bath and had that another patient, which she's supposed to take care of, is having pains. I don't know whether it's a chest pain or just pain. So, but the right answer for that was that the nurse was supposed to leave that patient she was bathing and go and care for the one that has a new onset of symptom. Because I know one of the things that NCLEX tries to do to every new nurse is to make sure that you can practice safely for the patient. And with that being said, when you notice a new onset of symptom, you are supposed to pay attention to that. You're supposed to assess it first to make sure that it's not something that when you leave it, it becomes a bigger problem. So, but I will let Laurie wade into that to give more insight to it.
Yeah, what they're testing for is, are you able to prioritize your tasks? And pain is more important than a bath. So, so then you would just, so the priority would be to help the patient in pain and then go back to give a bath, because you don't have to give a bath, but you do have to help a patient in pain.
Okay.
All right.
That's even one of the things they answered. They said if you continue with the bath, that the patient may continue pain. That means you don't attend to that patient at the right time. So that's one of the reasons they gave.
Okay, good. All right. So does that answer all your question, or you have more questions?
The position, I said the second one is for you particularly.
Must one use an agency? Well, the answer is no and yes. Agencies have their benefits and they have their disadvantages. Okay, so using an agency, you have something you're going to gain from it. I know some people who have used the direct hospital hire recently have been running into problems because there is no support. Because when you do direct hospital hire and you come here and your hospital that you're hired in does not like you or they don't feel comfortable training you, then they try to not really like fire you, but just to let you go because they brought you here. You're going to be on your own. And if you had an agency, it will help in that process to make sure you are well trained for the job, make sure that you are, getting the job that suits your qualification. Because with the time of processing, agencies are able to assess and know what kind of qualifications you do have, what kind of clinical experience you have, and with that, they'll be able to place you correctly to the hospital that you deserve to be in. But direct hospital hire has its own benefit, because when you're hired directly to a hospital, you get all the health insurance plans, you get all the benefits, all the retirement plan, like your, pension, whatever, 401k, you get all that, but in agencies, some of the agencies though, they do not give you all those opportunities. So these are the things that you gain, and you also get higher pay when you are in direct hospital hire than when you're with agency, because agencies are, they are your agency. So it's like you're going through a third party. So people that are going to take from your earnings is going to be the hospital and the agency. The hospital will take because they brought you there, and your agency will also do the same as well. So, but I'm going to find time to discuss the merits and demerits of agencies as against direct hospital hire. Then I will give you more insight about this, because it's a very big, broad topic that I would need time for me to sit down with you guys, give you life experiences, because I talk to people who come into the country on a daily basis, and I can tell you what challenges they are facing, broaden your scope so you can know whether you are going to go for it or not. But the choice is yours. Both can still get you into this country, but what happens later is now going to be your own circumstance, okay? Now I want to appreciate somebody that gave us $1,500 today, and that is Laurie. She actually came for this program. This hour that she spent with you is worth $1,500, but she did it for us free. So I want us to say a big thank you to Laurie. And it's not easy to get her, and we've been trying to make sure that we host this program together, but time has not been favorable to us. But today, Laurie, I just want to say a very big thank you to you. Thank you, and thank you, and thank you so much. Wish that goodness that we call you. Yeah.
Thank you, Laurie.
Thank you, Laurie.
Thank you, Laurie. We appreciate you.
We appreciate.
Thanks, everyone.
Thank you.
Thank you, Laurie.
Thank you.
Thank you. We love you.
We love you.
Okay.
Thank you.
Thank you, Laurie. God
I
bless
like
you.
Okay. All right. Thank you so much, Laurie. So I wish that when next we call on you to come, because we always have like a program every month. Yeah, thanks. We always have like a program every month. We try to bring somebody in. So I pray that next time we call you to come in and help us with another topic, I pray you have time for us, Laurie. I just pray you give us that opportunity.
Well, thank you. And I hope everybody goes out and be the best nurse they can be, because we need you.
Yeah.
We need you badly.
Yeah.
Thank you, Laurie.
All right.
Thank you, Laurie.
All right,
Thank
guys.
you so much, Laurie.
Thank you, Laurie.
Thank you, Laurie. We appreciate you.
Thanks so
Thank
much,
you,
Laurie.
Laurie. Love you
Okay.
so much.
Everybody saying they love you, Laurie.
Thank you. Love you, Laurie. Love you, Buzzy.
All right. Thank you so much. Thank you very much. And that brings us to the end of the event. Thank you so much for coming. And we're going to have another seminar this month.
Please, before we go, can she share our Facebook address again, please?
Oh, okay. So, Laurie, if everyone that is here is in our Telegram unit, we are going to Telegram, Facebook. I'm going to
Everybody on
share
Telegram, please.
Okay. You can check the comment section. She already shared it. And she is the CEO of the Empowered Nurses Org. So it's an organization where she empowers a whole lot of nurses all around the world. And she's been doing a great job there, and also helping nurses to protect their license. So you can follow her, you can chat her up if you have any complaint or anything that you think that she can help you out with.
Empowered Nurses.
Yes, she can help you out with your questions, and it's always good to have a contact like Laurie in your contacts, because whenever the situation presents itself, you need somebody to talk to. She is one person I know that will give you a listening ear. All right. Thank you, and God bless you, everyone. This brings us to the end of our program. And I'm glad that everybody was here. We had over 100 participants. Right now, we're at 92. And we thank God, all of us are nurses. Most of us are here in the United States. Some are still processing and back home. And we're happy that we had Laurie today to tell us how to protect our license. We'll be having another program this month. So watch out for our flyer on our different handles, Telegram, Facebook, and our WhatsApp platforms. You're going to get an update when we decide on when to host the program. Okay, but for now, from me, I'm saying thank you and God bless you. Stay safe. Keep being the best that you can be at all times. Bless you all. Bye.
Thank you, boss. Thank you, boss.
Thank you, Decency.
Bye. Thank you.
Thank
you,
Boss D. Good night, everyone.
Welcome.
Yeah.
Good night. Bye, boss. Bye.
You're welcome.
I'm sincerely grateful.
Yeah.
You people should come and start going, Jerry.